CEO of the Criterion Medical of our home. We welcome you to another episode of Health Watch on News Bostang NGTV. If you're just joining us on our channel, we encourage you to please subscribe to our channel and send the link of our videos to your loved ones so that they can benefit from the wealth of knowledge which we give out on the channel. So, continuing on our discussion on health issues, we've discussed previously on many health conditions like diabetes, like infertility, like sexually transmitted infections, on ulcer, and the likes. So today we'll be discussing on a condition that's it's really a threat in our society, and we just need to keep on giving people the right orientation, the necessary orientation on it, so that at least if we are not able to 100% eradicate this condition, at least we can help to bring it down to a very minimal level, and that is about sickle cell anemia crisis, sickle cell anemia disease. I believe we've all have, we've all at one point in time heard about this condition, sickle cell, and we mostly say SS. That's the general term we hear in the West, in Africa. That's what we term it to be, SS. So what are the necessary things we need to know about this, and how can we prevent it? Sickle cell condition, unlike other conditions we've discussed initially, it's a genetic condition. When we discussed about hepatitis, about STI, STDs, these are pathogens. That is, these are conditions that it wasn't in the person initially, but the person got exposed to it, maybe due to unprotected sexual intercourse, or maybe the person got exposed to the virus or to the bacteria somewhere else. But sickle cell on its own, it's a genetic condition, meaning the person is born with the condition. The person is born with the condition. And how does this happen? Without wasting much of our time, sickle cell is said to be diagnosed when two couples, a man and a woman, having the hemoglobin S. Hemoglobin S. You see, to form a child, the child needs 46 chromosomes and 23 from each of the parents, 23 from the father, 23 from the mother. So this is what will make up a whole child. So if the child, like you see some child, they will look like the father, the eyes will look like the father, the nose will look like the mother, the fingernails can look like the grandpa, or like that. So amongst what the child can inherit is, if one of the parents is AS, let's say having the sickle cell traits, the abnormal sickle, that is the S trait. Then the other parent is also having the S trait, meaning both of them are AS. So unfortunately, the child inherits hemoglobin S from parent A and also inherits hemoglobin S from the parent B, meaning the child's blood genotype will be SS. Not all child that is born out of AS will be SS, because the child can inherit hemoglobin A from the father and inherit hemoglobin A from the mother also. That means AS can even give birth to AA. And also they can give birth to AS. That is, you can inherit A from one of the couple and inherit S from the other of the couple. But unfortunately, it happens that if both are AS, they have 25% chance that the child that will come out of such union will inherit hemoglobin S. That is, I hope you are understanding what I mean by hemoglobin. Just like the child inherits, maybe he inherits facial look from the mother, and maybe inherits the shape of the ear from the father. So, the child inherits from both. So, if the child is unfortunate to inherit, it's not that the child on his own or on her own will we decide on, okay, this is what I want to inherit. No, this happens genetically. It's not what one can decide on its own, that, okay, this is what I want. No, it happens genetically. This is the choice from God Almighty. So if a child is unfortunate enough to inherit both hemoglobin S from both parents, then such child will be said to be having the sickle cell anemia disease. So now, what are those symptoms, and what are those conditions that come along with these sickle cell anemia disease? Sickle cell anemia disease, just as we said, that it's a genetic condition, and that makes it very difficult to cure, because it's not a condition that the person acquired. It's a born within condition. The person is born with such condition, and conditions like this are very, very difficult. Even if they will be cured, they have to pass through a whole lot of life-changing protocols, life-changing surgeries and the likes before they can be able to, change the genotype of the person. So one of the things that happen is that the red blood cell, in the blood, we have four components in the blood. We have three cellular components and one non-cellular component. The three cellular components, that's the red blood cell, erythrocytes, the white blood cell, the leukocytes, and the platelets, which is the thrombocytes. So these three cellular component of the blood, the red blood cell, it is circular in shape. This is what happened in sickle cell patients. This is how their pain. This is the agony. This is exactly where their pain is. The red blood cell. The red blood cell normally should be in an oval shape or concave shape. The red blood cell should be in concave shape, or let me say oval shape, to make it much more clear. So, it will be in circular form. So this is how in I don't want to say abnormal, because to them the sickle cell patients are not abnormal, but normally the red blood cell should be in oval shape, and it should be passing through the blood vessels, passing through the veins and arteries, capillaries, freely, because it's in circular form. So it's rolling and rolling and rolling and rolling and rolling. But in case of sickle cell patients, this is where they got their name from. This is where the word sickle comes from. Their own red blood cell, it does not make a full circle. It makes just like half, like C. It looks like a sickle, a sickle that is used to hunt, to cut in the farm. So this is how their own red blood cell look like crescent. Like when the moon is just coming out, like the moon, like the fifth day, sixth, seventh day moon, that is half, not even half, just like C. So instead of their own red blood cell to be in circular form, some of their red blood cell will be in the C shape. And imagine something rolling, because the blood cells are rolling through the blood vessels. So now, it's not possible for C to roll. I believe C now, so you should roll C on the floor. C can't roll because it doesn't make a complete circle. So this is what happened. So when their red blood cell form the C shape, so some blood vessels that are like, some goes like this, some goes like this. I believe you've seen blood vessel, so the way they look like, so they can, connecting from different, they are part of the connective tissues coming from the hand to the trunk to the neck and the likes. So if the blood vessel gets to maybe like a part that's like this, one goes like this, one goes like this, and the sickled red blood cell stay in between. If it is circle, it will easily pass by. But if it says it is C, instead of having the normal circular shape, so if it is C, so it can put a leg, can be in one part of the blood vessel, and another leg will be in another part of the red blood of the red blood vessel. I don't know what to use as an illustration. Let's say this is my hand here. So the normal red blood cell is coming. It comes normally because it's in oval shape. So it comes and passes through like this. It goes freely because it's in like a football, It's going easily. But now the sickled one is coming, but because of the shape, some can even be like V. Some can even much more bend than C. So now coming. Then it got to this place that has two junction. So one leg of it can be here, the other leg will be here. It won't be able to pass well because it's not in the normal circular shape. So if it now gets stuck here, the other red blood cells that are coming, they won't be able to pass because this sickled one, have caused a kind of hold up here. So the other blood vessel, the other red blood cells coming will now be lining up at the back. So there will be anemia here. There will be lack of red blood cell here because this place, the blood won't be able to get here again due to the fact that the sickled red blood cell have hanged over here, and it has caused some kind of hold up. So these other parts will be deprived of red blood cells. So and these parts, the blood cells will be sticked over there. So the patient, the sickle cell patient will now be having severe pains in this region, in both this region and this region, because this region will be deprived of the red blood cell. This region will be having too much red blood cell will be on this line. So the person will be having ache and severe pain. Like my wife is a sickle cell patient, and I try to ask her, how do you feel when you're having the pain? Whenever you're having the pain, the sickle cell pain, when you're having it, how do you feel? She said, what she can use it to illustrate, a little illustration she can give me is just like pounding like an hammer, someone pounding hammer on maybe on your part, on the part of your body, different part of your body, and at different times, like just hitting you on the hand, on the back, on the chest, just round your body. Can you imagine someone hitting you with hammer? I believe you know what's hammer. So imagine someone hitting you with such. She said that is what she can use it to illustrate. Someone even told me that she feels like, as if using stabbing, like the feeling is like stabbing around the body, stabbing in the leg, in the head, in the chest, in the back, just around the body. So this is how it happens. This is how the crisis happens. So if the red blood cell is, if they are sickled red blood cell, if it got stuck in between the blood vessels, so it will cause a kind of hold up there. So the coming red blood cell will be able to pass, and there will be severe pains for the patient there. And that's why they are mostly encouraged to take lots and lots of fluids, so that it can help to flush the sickled cell away from there. So that's why they are encouraged to take a lot of fluid. So now, how do we assist this generation of people, this sickle cell? How do we assist them? The first way you can assist them is to put a stop to the rising number of sickle cell patients. That is the first help. Not after you've given birth to them, then you look for how do you take care of them. At least try as much as possible. In the first instance, don't play towards, if check your genotype. You want to go into marriage, you want to go into a relationship, check your genotype. Don't put the child at risk. Don't like, at least I have a friend, she's AS, she married AS, and they gave birth to 3 children, and none of their children is SS. You are gambling with their health. Okay, I personally, I have a friend. He has 2 kids, and both of them are sickle cell kids. A woman messaged me like 2 years ago. She told me that she has 5 kids, and 4 of them are sickle cell patients. That in fact, their business, their everything they have is at the verge of winning. See, this is the fact that sickle cell is, you use money to manage their health conditions. So imagine someone having 4 of these children, 4 sickle cell children out of 5. So the first instance, don't even go near it. Make sure that no matter the love you have for someone, if you should get into it and you have just one sickle cell patient, I believe even if you are not fortunate enough, you will divorce. You will, as soon as possible, you divorce, because the agony in it is just too much, and especially for the woman, because Yorùbá will say tó bá délẹ̀ tán, tíní ní ní dà. So make sure that you check your genotype before going into any serious relationship with anyone. You want to get married, you want to settle down with someone, check your genotype. It's not because of you, but for the child. You spend the money. You really want to spend the money, you really want to spend the sleepless nights. I get it. But still, the child that is to be born out of such relationship, it's just as if you just want to put the child in pains. So that's the first step to help them. At least find, even though you are AS, you have the hemoglobin S trait. There are many AA persons. Get married to them. Are you getting it? So please don't say because I love you, I love you. My wife was telling me, this my sickle cell, she was telling me that she had a privilege to be talking to a sister, and the sister was telling her that she wants to get married. She was like, oh wow, may God put blessing in the union. Then she asked the sister that, what's your genotype? She said AS. The guy, because she said the guy is also AS. She said, both of you are AS and you want to go into the relationship. She's a sickle cell patient. So she was just trying to act like you both of you are AS and you still want to go into the relationship, and you have even choose dates. She was begging the sister that please, please, please don't go into it. The sister was saying, no, I love the guy. I don't want to leave him alone. I can't do without him. She was crying and begging the sister that, look at me. Look at my condition. Do you think I'm happy with being a sickle cell patient? So please, no matter the love you think you have for the person, it's just an infatuation. It's just for a short while. If you should get into the relationship and you have just one sickle cell patient, and if you're fortunate enough to have like 3, 4 of them, then you will know you know if really you love the person. So please don't gamble with their life. And if you're already having them, the best thing you can do for them is that try to understand them so much. I was at Lagos State Sickle Cell Foundation around Idiaraba, and a lady was there. She was crying. She was in pain. She was in sickle cell pain, and her mother was telling her, "Why are you crying? Why are you shouting? What's there? You are pretending too much." I was like, pretending? Because I've had the experience. The mother was telling the child that she's pretending after she's the one that put the child in harm. So she was now telling the child that the child is pretending that she want dibo by kilo leto by. She doesn't know the pain because she's not the one feeling the pain. So try to understand them. It's not easy to be a sickle cell patient. You try to understand them, show them love because they are already going through physical pains. So try to deal with them in emotional. Try to make sure that they have good emotional relationship with you. Try to be there with them. Try to be there for them. Try to show them love. Try to show them understanding because most sickle cell patients I know, they sometimes they feel like committing suicide. Even most times they feel like committing suicide because pains today, pains tomorrow, pains every time. So how do we manage sickle cell condition? There is no cure for sickle cell except what's scientifically, or let me say medically proven to be bone marrow transplant. That is the bone marrow, which is where the red blood cell is being produced in the bone, maybe in the humerus or in other bones like the ulna and the radial bone and other bones in the body. So the bone marrow there, this is where the red blood cell is being produced. So there is this transplant that the bone marrow of the relation of the sickle cell patient will be taken and there will be transplant. But this is not very absolutely 100% sure. It is also 50-50. And sometimes it can also lead to autoimmune deficiency, whereby the immune system will be fighting against the new bone marrow that is being transplanted into the person, and the condition can even be much more worse than the initial stage. So, but this is still the proven and widely accepted way to change the genotype, because we said it earlier that it is a genetic condition, so it makes it very difficult to control. But there are medications that is given, sold in chemists, like hydroxyurea and the likes, that are given to this patient, to this set of patients, that sickle cell patients, to assist to relieve them of their pains and prevent the sickling of the red blood cell. So if their red blood cell is not sickled, if their red blood cell is not in that crescent shape which I illustrated earlier, so they will have a normal daily activity and the likes. So the target is to prevent their red blood cell from becoming sickled. So, and that is these medications like hydroxyurea. That is one of the most commonly used one. Hydroxyurea is most commonly used because it's proven to assist them to prevent the sickling of the red blood cell. Although it has its own side effects, but we are not here to discuss the side effect. But it's generally accepted to be okay. And also in the natural way, being a naturopathic doctor, we have many natural products which we use, natural herbs which we use to manage sickle cell conditions. And the goal is to prevent the sickling of the red blood cell, because that is exactly where if the red blood cell is sickled, then problem comes in. So like cloves, which you call canoffle, we use it. Cloves, this black pepper, which you call iyere, and camwood, cloves, black pepper, and camwood. So these three plants, these three natural products. Camwood is what you call osupupa. You call camwood osupupa. So these three natural products are very, very effective. I even today, just today, I still have given I've sent some products out to some of my sickle cell patients, and I think this should be like the third or fourth time I've been sending products to them, and it works perfectly well for them. And also, they need a lot of folic acid. They need a lot of folic acid. So naturally, folic acid is well, it's in there's this plant, momodica, that's ewe jiri, which the Englishman call bitter gourd. So bitter gourd is very, very rich in folic acid. So they can be cooking it. You can get a handful of bitter gourd and be cooking it, and be taking some like two cups a day, 2 teacups a day is very, very ideal. It's worked very, very well. So for the cloves, you can get like 3 spoons of cloves powder, 3 spoons of black pepper powder, and just 1 spoon of, powder of these things. So 1 spoon of camwood, that's osupupa. So you mix them all together, and you take 1 teaspoon in the morning and 1 teaspoon at night. 1 teaspoon in the morning, 1 teaspoon at night. Once again, cloves, black pepper, and camwood. 3 spoons of cloves, 3 spoons of black pepper, and 1 spoon of camwood. Also, fenugreek is also a good option for them. So they can take a spoon of fenugreek, mix with warm water to take it. And there are so many plants that works quite well for them. But I think these three recommendations, that's the momodica, that's bitter gourd, to assist them to supply them a natural source of folic acid, and to prevent the sickling of the red blood cell. The fenugreek is a very good option. 1 teaspoon in the morning of the powder and 1 teaspoon at night, and also the cloves, the black pepper, and the camwood, which we just recommended. So we have a whole lot of things to discuss on that sickle cell, but because of time, and we would like to make this very brief. So please and please and please and please, if you want to get into any relationship, check your genotype. It's very necessary. It's very necessary. It may not be because of you, but at least consider the child that will come out of such relationship. It's not easy being a sickle cell patient. They have many complications. They used to have many, because due to the medications they use on daily basis, they have risk of having spleen problem, autosplenectomy. They can hepatomegaly. They can have kidney enlargement, liver enlargement, a whole lot of conditions, and most of them, they don't last long due to the fact that they are always having, and they are exposed to different infections. So please and please and please and please, this is just the little we can say right now. Let's stop the growing rate of sickle cell patients. It begins with me, it begins with you. If you are AS, please get a partner that is AA. Thanks so much, the Criterion Cares. You can reach us on 09032372682, 09032372682. Our head office is at Lagos State, number 16, Richard Abimbola Street, Ilasamaja, Lagos. Don't forget to subscribe to our channel and send the videos to your loved ones. Thanks so much, the Criterion Cares.